Dr. John here again. Okay, folks, while we're on this progression of how does a baby develop from central to peripheral, what are the essential 5 things you need? You need nerve supply, air, water, essential nutrients, motion. Okay, why are we talking about this stuff? Well, once you're brought into this world, once you exit that wonderful cocoon of the womb and we're into this harsh planet Earth environment, well, guess what? You're no different than that movie The Martian. I mean, once you were in that womb, okay, here you are, a baby inside of the womb. I can't draw, but it's okay. You were tethered to the placenta through your umbilical cord, okay? So everything was on demand. Nutrients on demand, essential nutrients, the fats and proteins I mentioned before, okay? Even some glucose, okay? Fats and proteins are getting through there. Air is getting through there, okay? Nerve supply, there's an interchange of the mother's nerve supply interfacing with the baby's nerve supply. Without either of them having that, the ability for that baby to grow in the womb is compromised. So once that baby, and the baby moves, once it gets to a certain, they're kicking, they're moving. Ask any mom how much kicking they felt. Okay, so all those essential requirements for that baby to develop have to be maintained throughout life. Well, you go from this wonderful environment where food is on demand, excretion's on demand, it's 98.6 degrees, it's like a nice little sauna in there, it's perfect, the sounds are muffled, the lights are muffled, and then, okay, when the due date is there, hopefully you're allowed to express and be born vaginally with the, as according to your due date, but so you got to do what you got to do. We'll talk more about different births, but once you're expelled, so to speak, from the womb, what happens? You're exposed to bright lights. You're exposed to different temperature that might be 20 degrees less than you were exposed to in the womb. The sounds are very loud now, and all of a sudden, wow. And then within minutes or seconds, you get your lifeline severed, okay? So you've lost that tether that's been your lifeline from the time of conception. So it's rather traumatic. What we're getting at is this. Early on, babies express a challenge with transitioning from the womb to the world. We call that a colicky baby, all right? You're transitioning from this food coming directly into your system, like a feeder line or a feeder tube, right into your body. Air, nutrients, waste is exchanged through this tube called your umbilical cord. Well, now you have to do it through the oral cavity, get your nutrients. Now you have to expel it through your own digestive tract, okay? Now your lungs have to work. So in this transition, sometimes there's distress, okay? And that's what we do in chiropractic. A colic baby is a baby whose nerve system has been somewhat stressed out by that transition from the womb to the world. The job of the chiropractor is to restore the continuity of the spinal bone so the energy can flow. And you'll see these babies mellow out immediately because you're affecting the autonomic nerve system. Okay, we're affecting the autonomic nerve system. That baby's world was perfect. Now we're in somewhat less of a perfect world. It's just a lot more stressful. And it depends too if that baby was induced, if that baby was born with forceps, which meant it had somewhat of a traumatic experience leading up to that C-section or that forceps. I was a forceps baby. But there's different degrees of stress and trauma in a birth process as well. So there's a lot of things that go on. So when you have a colicky baby, what we do in chiropractic is we adjust the cause. They just melt on the table. I lay the baby on their mom, and I just take very gentle thumb contacts near the skull, near the sacral, low back area. I'll use my hands. I use a gentle instrument called an arthostem. These babies just melt. It's a little woodpecker, 12 pulses in a second's time. That is the fractions of an ounce, just tapping and opening up those nerve channels, activating motion, okay? That's what the chiropractic does. The chiropractic adjustment does. It activates energy. It activates energy. This chart over here, the autonomic nerve system chart, it's all about the autonomics, the balance between the throttle up and the throttle down divisions of your nerve system that runs the show without you thinking about it. So the next time you have or encounter someone with a colicky baby, all it is a difficulty with transition. And your nerve system accommodates and adapts you to every stress you will ever encounter in your life. But the chiropractic adjustment restores balance and potential, full potential to that nerve system so that that baby can express health and adapt on this planet Earth. Now, a baby that's colic that doesn't get adjusted is likely to have other issues as well down the road. So you owe it to everyone you talk to. If they have a colic baby, have them check out a chiropractor who adjusts the spine. Have a great day.